name is Dr. Joshua Taylor. I'm a general surgeon. I'd like to thank you for coming to see me today in consultation. I'd like to use this time using this video to explain the reason you're here to see me and answer some questions so that when you and I sit down, we can have a more in-depth conversation about what it is that is exactly going on with you or any questions or concerns that you might have. Hemorrhoids are enlarged blood vessels around the last part of the rectum and the beginning of the anus. Hemorrhoids are natural. They're supposed to be there because they act as a cushion to help keep us continent so that we don't stool or leak gas all the time. What can happen over time is that because of issues of constipation or straining, women who've had children or other causes can cause those blood vessels to stretch and enlarge, and that can create pain, can cause bleeding, can sometimes cause tissue that you feel in your bottom that protrudes, that sometimes you have to push back in, or in the most severe cases are always present. There are two types of hemorrhoids. There are internal hemorrhoids and external hemorrhoids. Oftentimes, internal hemorrhoids are more problematic because they cause bleeding, and external hemorrhoids are more painful because they stretch the skin and cause pain. So when hemorrhoids become severe enough to cause you constant pain or constant issues with bleeding, or you experience tissue prolapsing, we oftentimes recommend surgery. The surgery that we perform is to eliminate the hemorrhoids that are a problem. So one of the most common questions that I ask patients are about their symptoms, and if they're experiencing increased amounts of bleeding with every bowel movement, or pain with every bowel movement, oftentimes we proceed with surgery. Surgery can be done in several different ways. One of the most common ways that I perform the surgery is by identifying where that enlarged blood vessel is and tying off the blood flowing into it. That prevents it from being able to enlarge and get irritated and bleed. And then that tissue that has been stretched out, we take and we suture back into its correct position. Now, in some scenarios, the hemorrhoids are so severe that we actually have to cut them out. In general, we try to avoid that because that is a more painful approach, but if your hemorrhoids are so severe, that may be the only option that we have. In general, hemorrhoid surgery is very safe. Because a hemorrhoid is a blood vessel, one of the most common risks associated with hemorrhoid surgery is bleeding. Thankfully, with the newer techniques of identifying the blood vessels and tying them off, that risk has overall been decreased. There's also risk of infection. As you might imagine, that area is not the cleanest, and so there is a little bit of an increased risk of infection. Now, when we do the surgery, we'll give you some antibiotics at the time of surgery, but you don't need antibiotics to continue on at home. There's a very low risk of developing something called incontinence, which is where you can't hold on to things, and that's often because the muscles in that area get stretched out from when we perform the surgery. I'll be in momentarily to talk with you and be more specific about what it is that's going on with you and how I think surgery might help. If you have any questions, feel free to write them down. You can re-watch this video and you and I will go through them when we meet.